Here are 4 things to watch for if you just had your baby and you're now discharged home from the hospital. But first, make sure you follow the postpartum nurses for more postpartum, newborn, and breastfeeding tips. First, you want to make sure that you're watching out for postpartum hemorrhage. This is bleeding where you start to soak an entire pad from front to back within 1 hour. If you're passing large blood clots that are golf ball lemon size, or if you have any vaginal bleeding that has now started to increase in the amount that you're used to seeing, or if you're now seeing your bleeding turn back into a bright red color, those are concerning and you want to make sure that you let your healthcare provider know. Next is preeclampsia, and yes, you're still at risk for this developing actually up to 6 weeks postpartum. Signs and symptoms that you want to watch out for are going to be an increase of blood pressure, typically about 140 over 90 or higher, severe headaches, seeing spots or having blurry vision, swelling in your hands and face, having some stomach pain, or even having nausea and vomiting. Now, you also want to keep an eye out for signs of infection. This can be an incisional site infection, or this can be a vaginal or uterine infection. Signs and symptoms of infection are going to be having fevers, chills, a vaginal discharge that has a foul odor to it, any pain or tenderness in your abdomen, or if you're having an incisional site infection, that would be redness, swelling, or drainage from that incisional site. And lastly, you want to keep an eye out for signs of a blood clot. You are actually at a higher risk for developing blood clots in the postpartum period. Now, signs of a blood clot are going to be if you have any difficulty breathing, shortness of breath, or if you're having any pain, redness, or swelling in your leg. And you just want to make sure that you are not massaging or trying to stretch that area, because you are at risk for dislodging that blood clot and having it travel to other important parts of our body, blocking that blood flow. Now, here are some other maternal urgent warning signs that you want to make sure that you're keeping an eye out for. And of course, if you're never not sure if what you're experiencing is normal, please make sure that you're reaching out to your provider and letting them know what's going on.